CLSI, clinical laboratory rules. For the Salmonella and Shigella species, which are tested for from the fecal isolate, only ampicillin, fluoroquinolone, and trimethoprim sulfamethoxazole should be reported routinely. For extraintestinal Salmonella isolates and Shigella isolate, the third generation cephalosporin chloramphenicol may be tested and reported if requested. The susceptibility testing is indicated for the typical Salmonella S. typhi and S. paratyphi A to C, while susceptibility testing for Shigella is indicated for all isolate. The first and the second generation cephalosporin may be active in the vitro but not reported because it is not effective. For cystic fibrosis patient with the Pseudomonas aeruginosa infection should be incubated up to 24 hours. Then note down the susceptibility pattern. Pseudomonas may have developed the resistance to initially report drug within 3 to 4 days, so the repeat testing may be warranted. In MRSA, the resistance to all currently available beta-lactam agents like agmentine, clavonic acid, etc. For Enterococcus species, aminoglycoside, cephalosporin, and clindamycin and septron may appear active in the vitro, but they are not effective clinically. So we are not need to report aminoglycoside, genta, cephalosporin, and clindamycin, and trimethoprim sulfamethoxazole. But we can check the Genta 120 to confirm the synergistic effect of ampicillin or vancomycin or aminoglycoside can be predicted by Genta 120. If it is susceptible, then synergism is there. So we can use the ampicillin and vancomycin with the combination of aminoglycoside in such cases. For Haemophilus influenzae and parainfluenzae, 0.5 McFarland suspension containing approximately 1 to 4 10 to the power 8 colony forming unit per ml. Higher inoculum may lead to the false resistance. And if H. influenzae in CSF, the testing result of ampicillin third generation cephalosporin, chloramphenicol, and meropenem is appropriate to report. And agmentine, azithromycin, cheletrocefaclor, cefprozole, and cefixime and trimethylithromycin oral agent may be used empiric therapy for the respiratory tract infection with the influenza species. Neisseria gonorrhea, the clinical effectiveness of cefoxitin and streptomycins with the resistant or intermediate isolate are unknown. So our only agent so reported as intermediate susceptibility, which is cefoxitin and cefmetazole and streptomycin and cefoxitin. The most important feature of gonococci that it produced the zone of inhibition less than or equal to 19 mm around the 10 unit penicillin are likely to be a penicillin or beta-lactamase producer. In the gonococci with the 30 microgram tetracycline disc zone diameter less than or equal to 19 mm usually indicate the plasmid mediated tetracycline resistant and should be confirmed through the dilution test medium with MIC, which is greater than or equal to 16 micron per ml. In case of Streptococcus pneumoniae, when testing with the chloramphenicol, clindamycin, erythromycin, linezolid, and tetracycline by both dilution method and MIC can make endpoint determination very difficult. In case, read the MIC with the lowest concentration where the tailing begins. The agmentine, ampicillin, cefepime, cefotroxone, imipenem, and meropenem may be used to treat the pneumococcal infection. However, the reliable disc diffusion susceptibility test agent do not yet exist in the vitro. Best method is MIC. In case of Streptococcus pneumoniae, FDA do not approve the cefepime to be used in a CSF isolate, while the clindamycin induced resistance can be detected by the D-zone test. Streptococcus beta hemolytic streptococci in Veridon groups, the penicillin and ampicillin is the drug of choice for the treatment of beta-lactam group, beta hemolytic group. So for the penicillin and ampicillin is not reported as resistant, if found must be retested. And Streptococcus ingenuus, previously called the S. milleri group, having the small colony forming the beta hemolytic strains, are categorized as Viridon group of streptococci. In Neisseria meningitis, the perform all the antibiotic susceptibility testing for the N. meningitis in biosafety cabinet, because manipulating outside biosafety cabinet is associated with the increased risk of contracting the meningococcal disease in laboratory acquired meningococcal infections case rate, which is 50%. Air droplet or aerosol most likely a risk factor in case of Neisseria meningitis. Specimens are acceptable for virology if it is transported in a moist viral or chlamydial media, transport media, which is M4 and M5. Universal viral transport media can be replaced by M4. And body fluid and the washed specimen for the viral culture must be collected in the sterile container without dilution. For the viral culture, swab stick must be metallic. All other are toxic. M4, M4, RT, and M5 and M6 microtest TM must be 0.5 to 3 ml dilution to keep the sample moist. For the chlamydia culture, do not add more than 0.5 ml of the fluid chlamydia transport media or M4 or M5. The respiratory syndrome viruses and precarditis and central nervous system syndrome viruses, the chlamydia pneumonia, take the 4 weeks. Antibodies detection can also be done in the case of mumps, measles, and Varicella zoster viruses. For the chlamydia, and cyclohexamide is used before culturing on artificial media. Cyclohexamide are eukaryotic protein synthesis inhibitor produced by the Streptomyces gravices, which are used in the cell lines like Mikoki, HEPA2, HeLa, and buffalo green monkey cells. HeLa cell lines are originally isolated from the Heritha lax, which is the woman with the cervical cancer in February 8, 1951. These cell lines are immortal cell line used in the scientific research. It is the first human cell culture. HeLa have stable growth medium to enable the successfully grow the polio viruses for developing a vaccine in 1954 by Jonas Salk. In 1955, the HeLa cell lines were the first human cell lines which successfully cloned the Paro and papilloma viruses. Mikoki cell lines are also used for cultivation of viruses, and most probably it is used for the cytopathic effect of viruses. Some viruses show the cytopathic effect on cell lines. HEPA2 is also from the human source, which is laryngeal carcinoma cells and human epithelial type 2 cells, which most widely used for ANA titers, which is antinuclear antibodies in case of autoimmune diseases, while Vero cell lines are kidney epithelial cell from African green monkey cells. Basically, it is first used to isolate the toxins of E. coli, which is named as virotoxins, rather than later on named as Shigella-like toxins. Viral stock, especially the rabies, can also be achieved on Vero cell lines. In eukaryotic parasitic, especially trypanosomad, which is a parasite, can be also preserved and grow on these cell lines. The Vero cell lines do not excrete the interferon alpha and beta, which infect the viral growth. So it is very good cell lines to grow most of the viruses, while the buffalo green monkey cell, which is BGMK cells from African green monkey kidney cells, are commonly